And you ask, we answer all your vaccine and CDC questions this morning. Happy to be joined once again by Dr. Hussain from Trinity Health of New England.
Yeah, doctor, thanks so much for joining us once again, and happy Friday.
You too. Glad to be back.
All right, big news here. We have to ask you first off the top. The U.S. taking another major step on the road to normalcy as the CDC easing up mask wearing guidance for fully vaccinated people. Do you think this will hurt or help with the numbers?
So this is a historic milestone in our journey together during this pandemic. So why did the CDC make this decision now? So viewers need to keep a few things in mind. So we've always known, based on data from the clinical trials, that the currently licensed vaccines are highly effective in preventing severe clinical disease, hospitalization, and death from COVID-19. What we didn't really know was how likely is it that an individual who is fully vaccinated is still able to transmit the virus. So now, based on new data coming in fact, there are 6 studies that have been published, along with real-world data from countries such as Israel, we know that the likelihood or chance of an individual who's fully vaccinated passing on the virus is negligible at best. Hence the revision in CDC guidance in terms of masking. Now, what viewers need to keep in mind, caveat here is, if you're visiting a hospital or healthcare setting or congregate setting, or if you're traveling, whether it's taking public transport, flying, taking the train, you will need to wear a mask.
Okay, and now let's start talking about how these changes are affecting different people's situations. We got a question in from Glenn who said, what's the appropriate indoor protocol for vaccinated grandparents over 70 and unvaccinated grandchildren under the age of 10?
Sure. So let's share some good news on this question as well. So we know at this point, we have around 72% of individuals who are 65 and above in the United States that have now been fully vaccinated. So what this means is if you're a grandparent and you're fully vaccinated, which means 2 weeks or more after you've completed your vaccine series, and you want to visit your children or grandchildren who have not yet been vaccinated, it is safe to do so. You won't need to socially distance. You won't need to wear a mask. However, the caveat here is those individuals in your family who are unvaccinated should not have a higher risk for developing severe COVID-19 disease. So as long as they don't have medical comorbidities, they're obese, immunocompromising conditions, then it is safe to relax those public health measures when you're with them.
All right, doctor, we have a couple questions about the vaccine and people's individual health situations. We have a question from Julia. She asked, should I be wary if I had a diagnosis of immune thrombocytopenia or ITP? Now, she did add that that diagnosis was about 30 years ago.
So please consult your physician. It would be safer to take one of the messenger RNA vaccines, either Pfizer or Moderna, and avoid Johnson & Johnson if you have a history of ITP or TTP in the past.
Okay, well, Dr. Hussain, thank you so much for the time. Of course, we have more questions on backlog, and that's why you will keep joining us to do more editions of You Ask, We Answer. Thank you for the time you have given us today, though. Good to see you again.
Yeah, we really appreciate it. Thanks so much.
Thank you.
And if you at home have a question for us about COVID-19 or the vaccine, just send it to us. It's share61@fox61.com. That's the email. And if you're a texter, you can text it to us too. 860-527-6161. That's a real easy way to get it to us.
Yeah.